Consider the trajectory of a typical pair of lower limbs between the ages of 55 and 75 if left unchecked. This is not a description of an extreme scenario, but rather the standard progression. It is the kind of subtle decline that develops so gradually you never pinpoint the exact moment a boundary was crossed. The process begins with your footwear. Upon removing your socks at night, a distinct indentation remains pressed into the flesh just above your ankle. You dismiss it as nothing unusual, assuming everyone experiences the exact same thing. By the subsequent phase, that identical impression fails to fade, remaining visible even when you wake up. During the following stage, the skin where that band used to rest undergoes a permanent discoloration that never reverts to normal. That entire downward slide spans roughly 2 decades. The most peculiar element of this condition is that the bulging, visible surface vessels are not the actual source of the issue. They merely represent the secondary effects of a hidden problem. The true origin of the trouble resides somewhere else entirely, specifically within a deeply buried calf muscle that rarely crosses anyone's mind, despite executing one of the most vital tasks in your entire cardiovascular network. The moment this particular structure ceases its activity, the aforementioned progression begins to accelerate. Consequently, my goal today is to guide you through that chronological sequence step by step. We will examine your present baseline, the developments expected in 18 months, the shifts occurring over 5 years, and the precise moment on that timeline where you still possess the power to reverse the entire process. A standard, brief medical consultation is simply not structured to guide you through this complex topic at a gradual pace. That limitation is not a grand plot, it is merely the reality of a packed schedule. For that reason, let me dedicate the necessary time to explain it properly right now. You are currently in the initial phase, and the absolute reality is that most of this first stage remains completely unnoticed by you. Let me highlight exactly what your lower extremities are doing this very second as you read these words. Oxygenated fluid travels downward toward your feet with absolute ease because gravity handles that labor entirely for free. The genuine challenge is the return journey upward. The vessels in your lower limbs are forced to transport fluid uphill against a constant gravitational pull every single day, traveling all the way from your ankle back to your heart. To achieve this monumental task, they depend heavily on 2 precise mechanisms: microscopic, one-way structural flaps within the vessels known as valves, and a physical pumping action. Picture a water transport system designed to ascend a steep incline. You cannot simply expect a liquid to move upward on its own. To solve this, engineers construct a sequential series of stepped chambers. Each individual chamber functions as an enclosed space equipped with a mechanical barrier. As water enters, the barrier snaps shut behind it to prevent any backward leakage, and the liquid is then elevated into the subsequent chamber. Section by section, the water ascends the incline, achieving a climb it could never manage independently. The internal vessels of your lower limbs operate in a manner identical to that stepped system. Those internal flaps serve as the barriers, while the physical mechanism that elevates the fluid from one chamber to the next is your actual lower leg muscle. With every single step you take, your calf compresses the deep internal vessels embedded within it, forcing a column of fluid up past the next structural flap. That internal barrier then seals tightly behind the volume, rendering it impossible for the liquid to drop backward. That is the fundamental anatomy of the system, and it is precisely how your body successfully counters gravity throughout the day.
During this initial phase, those internal barriers still manage to seal properly. The muscular mechanism still engages, but your daily habits have shifted toward much more sitting than you used to do. Alternatively, you might find yourself standing at a counter for long stretches without shifting your weight. As a result, that muscular mechanism is only operating on a part-time basis. Consequently, what are the physical sensations you experience? You might notice a distinct sensation of heaviness in your lower limbs by the time evening arrives, or a dull, persistent ache following a prolonged day spent on your feet. Perhaps one specific ankle appears slightly more swollen than its counterpart by bedtime, only to return to normal by morning. You notice that sock mark, feel the exhaustion in your limbs, and simply attribute it to the natural aging process. What you remain completely unaware of at this point is the activity occurring beneath the surface. Behind the scenes, fluid is beginning to linger at the base of that vascular pathway slightly longer than it normally should. The internal strain within those lowest vessels is steadily intensifying. The surrounding structural walls are expanding at a microscopic pace, mimicking the exact way a rubber balloon left partially blown up for years completely loses its elasticity. This is the single most critical concept to grasp regarding this initial stage. You feel virtually no discomfort, and that exact absence of symptoms is precisely why individuals fail to intervene. The specific time frame where this condition is most straightforward to remedy happens to be the exact period when it causes you the absolute least amount of trouble. The second phase typically manifests anywhere from 18 months to 2 years down the road if that muscular mechanism remains inactive. At this juncture, the fluid retention no longer completely dissipates during the night. You get out of bed and notice the ankle is closer to its normal shape, but it has not fully recovered. By the middle of the afternoon, the swelling has returned. The mark left by your footwear is noticeably more pronounced and endures far longer. Furthermore, you now begin to spot distinct visual changes. You notice prominent, twisted vessels of a blue or deep purple hue rising noticeably above the skin surface, typically situated on the back of the leg or right behind the knee joint. These are known as varicose veins, a term that fundamentally describes a blood vessel that has grown enlarged and distorted. Right here, I need to dismantle a pervasive misconception, because it is the single most detrimental and costly belief you can possibly hold regarding your vascular health. The misconception is the idea that the visible, protruding vessel itself constitutes the core problem, leading people to believe that if they could simply eradicate that single unsightly vein, they would be completely cured. The scientific truth, as validated by major medical institutions like the Cleveland Clinic, is that a protruding vessel is merely a visible indicator of a much deeper internal malfunction. The structural flaps inside that specific pathway have completely stopped forming a proper seal. The moment an internal barrier fails to close, gravity immediately takes control of the situation. Fluid that was supposed to be elevated to the next chamber drops right back down the pathway instead. Medical professionals refer to this specific phenomenon as venous reflux, which is simply the backward flow of fluid moving in the entirely wrong direction down that vascular staircase. This backflow pools directly in the chamber situated below it. As a consequence, the internal pressure intensifies, and the structural wall of the vessel, which has already been stretched out over time, balloons outward into plain sight. Therefore, that visible protrusion on your skin does not represent the actual disease itself. It is merely a biological pressure indicator. It is sending you a clear signal that somewhere further down the line, an internal barrier has failed, and the muscular mechanism is failing to keep up with the workload. You can focus all your attention on that visible vessel, but the components that actually failed are the unseen internal flaps and the muscular action that stopped supporting them. During this second phase, you also begin to perceive a variety of other physical sensations. You might experience persistent itching directly over the affected vessel, a distinct throbbing or cramping sensation at night while trying to sleep, or restless lower limbs that simply refuse to settle down. These varied symptoms are all telling the exact same underlying story in different ways. Fluid is pooling in areas where it simply does not belong, and stagnant fluid naturally irritates the surrounding biological tissue. Here is a specific statistic that is well worth remembering. Data indicates that approximately 1 out of every 3 adults encounters these types of enlarged vessels. Thus, if you are experiencing this issue, your situation is not at all bizarre or unique. You are surrounded by a massive segment of the population. However, there is a critical detail that the rest of that group rarely mentions. Approximately 1 out of every 50 of those individual cases advances each year into a far more advanced and serious state. That is the slow, quiet slide moving from the second phase directly toward the third stage, progressing steadily at a fraction of an inch at a time. The third phase typically arrives around the 5-year mark or even further down the road, occurring when that elevated pressure at the base of the vascular pathway has persisted long enough to alter the surrounding tissue itself.
I want to discuss this stage with utmost precision and a calm demeanor, because this is the specific point where people tend to become frightened, and panic is completely counterproductive to your health. Let me simply outline the physical reality in straightforward terms. The skin surrounding your ankle region begins to exhibit a distinct alteration in color, shifting toward a brownish, rusty tint that usually manifests on the inside of the ankle first. That specific coloration is actually a direct result of iron deposits. Red blood cells have been steadily seeping out of those overpressurized vessels into the surrounding tissue, and as those cells naturally break down, they leave a permanent iron stain behind in the skin. Additionally, the affected skin can become remarkably firm and rigid, feeling almost wood-like to the touch because the trapped, stagnant fluid triggers the formation of dense scar tissue. The formal clinical term for that specific hardening process is lipodermatosclerosis, a medical phrase that simply indicates that both the skin and the underlying fat layer have become chronically inflamed and stiffened. By the time you reach this particular stage, the fluid retention is present throughout the majority of the day rather than just appearing in the evening. In the most severe cases, the skin overlying the ankle becomes so profoundly deprived of nutrients and fragile that it eventually splits open, creating a persistent wound that cannot close on its own. That specific type of injury is known as a venous ulcer. It represents the absolute conclusion of this particular chronological pathway, and it is precisely the severe outcome we are trying to avoid at all costs. At this advanced point, medical professionals classify the condition as chronic venous insufficiency, which describes the long-term failure of the lower limb vessels to successfully return fluid back up to the heart. Clinical documentation emphasizes that this condition typically manifests after the age of 50, with the overall risk factors climbing steadily the older an individual gets. The clinical progression is officially categorized into stages ranging from 0 all the way to 6. At stage 0, you experience a sense of deep fatigue in your lower limbs, but there are no visible signs on the surface. Upon reaching stage 1, you begin to observe tiny spider veins, which then advance to prominent varicose veins by stage 2. The subsequent higher numbers represent the distinct skin alterations and the open wounds that I just detailed for you. Now, I have just guided you down a very long, gradual descent, moving from initial heaviness to visible vessels, then to structural skin changes, and finally to an open wound that refuses to close. That represents a 20-year span stretching from that very first sock mark to the final, advanced phase. Right here is the single most vital statement contained within this entire discussion. You are absolutely not a helpless passenger trapped on this automatic chronological track. There is a functional mechanism available to halt this progress, yet almost no one is utilizing it simply because almost no one realizes exactly where that mechanism is located. Therefore, let us identify that halting mechanism together. Let me point out the precise location on this timeline where you can fundamentally alter your trajectory. That mechanism is not located within a blood vessel itself, as you cannot fix an enlarged vein by simply massaging a topical cream onto it. The actual halting mechanism is the muscular pumping action, which means the key is your calf muscle. Think back to that water transport system with its stepped chambers. There are exactly 2 distinct ways that entire setup can break down. Either the internal barriers fail, which represents the damaged valves and backflow, or the mechanical mechanism stops lifting the fluid. The latter scenario occurs when your calf muscle falls completely silent due to excessive periods of sitting combined with a lack of genuine physical movement.
Here is the incredibly encouraging part of the story, and I truly want you to internalize this concept. Once those internal vascular flaps suffer severe damage, they generally do not possess the ability to mend themselves, meaning that specific structural breakdown is highly difficult to reverse. However, that mechanical pumping mechanism is a muscle, and muscles inherently adapt and respond the moment you begin to challenge them. A weak, inactive calf muscle places a massive amount of extra strain directly onto the internal barriers that are still functioning correctly. Conversely, a robust, actively engaging calf muscle completely relieves that extra strain, emptying the vessels far more thoroughly with every single step you take and drastically reducing the built-up pressure at the base of the pathway. While you cannot structurally fix a broken internal barrier, you can absolutely build a muscular mechanism so powerful that it easily handles the physical workload those failed barriers can no longer manage. That is the exact point of interruption, the precise spot where the trajectory changes completely. Crucially, that shift is achieved not through surgical intervention or a pharmaceutical pill, but by targeting one specific muscle that has somehow been completely omitted from the mainstream conversation regarding vascular health. Make sure to follow along so you do not miss the upcoming breakdown. These physiological mechanisms are deeply interconnected, and the subsequent information builds directly upon this muscular pumping concept. So which specific muscle are we discussing? This is the point where the anatomy becomes genuinely fascinating, because if you asked the average person to point directly to their calf muscle, they would almost certainly grab the large, rounded mass that stands out prominently whenever you rise up onto your tiptoes. That particular structure is the gastrocnemius. It is entirely real, it holds genuine structural value, but it is absolutely not the muscle I am here to focus on today. Positioned right underneath it, sitting deeper and presenting a much flatter shape while running from just below your knee joint all the way down to your heel bone, is a second muscle structure. This hidden tissue is called the soleus, and it is the exact muscle that almost everyone has overlooked. Throughout the vast majority of medical history, this deep muscle was viewed merely as a quiet background participant, a basic postural muscle whose primary job was simply helping you maintain an upright standing balance. However, everything changed when a scientific research team at the University of Houston published a groundbreaking study that completely transformed how the scientific community views this specific tissue. They discovered that this deep muscle, despite accounting for a mere 1% of your total body mass, possesses an absolutely extraordinary metabolic profile. Unlike the vast majority of muscles in your body, which rapidly deplete their stored glycogen reserves and succumb to exhaustion quickly, this deep structure utilizes a completely different fuel combination that allows it to remain continuously active for hours on end without experiencing fatigue. The researchers coined a specific movement designed explicitly to engage this tissue, calling it the soleus push-up. Here is the exact reason why this discovery carries such monumental significance for the health of your blood vessels. This deep muscle serves as the true unseen workhorse powering your entire lower limb circulatory pump. It is physically wrapped directly around the largest, deepest blood vessels situated in your lower leg. When this muscle contracts, it exerts a powerful compression force on those deep vessels. Because it possesses this unique resistance to fatigue, it can continuously compress and elevate fluid up that vascular staircase for far longer stretches of time than the prominent, flashy muscle sitting on top of it. Picture the scenario clearly. This overlooked deep muscle is the true engine driving your circulatory pump. In a modern society where we spend hours on end parked in chairs, it is the exact part of your anatomy that shuts down first and stays inactive the longest. We did not lose our circulatory pumping power because the mechanism itself wore out over time. We lost it simply because we stopped instructing the engine to run. That is the fundamental revelation of this entire discussion. Achieving lighter, less uncomfortable lower limbs does not come from desperately focusing on the visible vessels on the surface. It comes entirely from reawakening the deep muscle you forgot you possessed. Before I lay out the actionable strategy, I must pause and establish a strict, absolute boundary because we are dealing directly with your circulatory system, and I refuse to be careless with your health. There are specific clinical warning signs that mean you absolutely do not attempt exercise, and you do not wait to see what happens. Instead, you immediately contact a medical professional. If a single leg suddenly exhibits a massive amount of swelling compared to the other side, and it simultaneously feels warm, tight, painful, or displays a distinct redness that can indicate an acute blood clot, that scenario represents a medical emergency, not a basic muscle pump issue. Furthermore, if you ever experience sudden chest pain or an abrupt shortness of breath accompanying your leg swelling, that is a situation requiring an immediate call for emergency medical help. If you notice an open sore on your lower leg that refuses to heal, broken skin, or active bleeding from a visible vessel, that requires the direct intervention of a clinician, not a home exercise routine. Additionally, if your skin has already transitioned into that hard, browned state, you have progressed past the stage where physical movement by itself is sufficient. You absolutely still need to move, but you must do so strictly under professional medical guidance. Here is one more vital rule. If you currently utilize prescribed compression garments, or if you take any form of blood thinners or cardiovascular medications, you must consult your physician before altering any aspect of your daily regimen, including the introduction of this specific program. Physical movement is a powerful form of medicine, but you never alter your medical routine entirely on your own. The strategy I am about to detail for you is designed specifically for addressing heaviness, fluid retention, persistent aching, and the early stages of visible bulging, the precise phases where the muscular pump acts as the primary lever for improvement. It is absolutely not a treatment plan for a blood clot, an open ulcer, or advanced cardiovascular disease. Let us agree to maintain that clear line of safety together. Now let us explore the 21-day routine designed to reawaken that deep muscle and completely rebuild your circulatory pump. A 21-day time frame is not a mystical number. It represents roughly the exact duration required for a dormant muscle to begin responding to regular stimulation and for daytime fluid retention to noticeably decrease. You are absolutely not going to completely erase a prominent blood vessel that is already physically present in a matter of 3 weeks. Anyone making a promise like that is simply trying to sell you a product. What you can fundamentally alter in a 3-week span is the actual physical sensation in your legs, the overall volume of fluid retention, and the precise direction you are traveling along that health timeline. I want to be completely upfront with you about those expectations, because absolute honesty is the most valuable thing I can provide. The program is built on a clear framework featuring 3 distinct layers, which we will introduce sequentially, 1 week at a time. The first week focuses entirely on the seated heel elevation, and you execute this movement while remaining seated, which is the foundational purpose of the exercise. Sit comfortably with both feet resting flat against the floor, ensuring your knees are bent at approximately a 90-degree angle. From this position, elevate your heels entirely off the ground while keeping the balls of your feet and all your toes firmly planted. Apply downward pressure through the front portion of your foot so that your heels rise as high as they can comfortably manage, and then simply allow them to return smoothly to the floor. That constitutes a single repetition. The scientific team discovered that this specific seated motion uniquely isolates and targets that deep muscle tissue. You should perform this movement in a slow, rhythmic fashion, akin to casually tapping your foot to a piece of music. It should never feel rushed or forced. Your primary objective throughout this first week is simply accumulating duration. Aim to perform this movement in continuous stretches of roughly 10 minutes at a time, repeating it a few times throughout your day. You can easily do this while watching a program, reading a book, or sitting at the table after completing a meal. Over time, you can easily build up to much longer sessions. This specific muscle does not experience fatigue the way your other muscles do. The true brilliance of this exercise is that you can execute it during the exact sedentary periods that created the circulatory problem in the first place. The very hours that previously put your muscular pump to sleep now become the exact hours you utilize to wake it back up. Moving into the second week, we introduce the standing heel raise to engage the entirety of your leg pump. Position yourself directly behind a solid, stable chair, placing your hands gently on the backrest to maintain your balance. Rise up smoothly onto the balls of both feet, elevating your heels as high as you possibly can. Maintain that peak position for a clear 2-second count, and then lower yourself downward in a highly controlled manner, taking a full 3-second count to return to the floor. That slow, deliberate lowering phase actually carries significantly more therapeutic value than the initial upward lift. Begin by performing a set of 10 repetitions twice a day, gradually working your way up toward 15 or 20 repetitions as the movement becomes easier. This specific exercise is the one that applies the maximum compression to the deep vessels, emptying that vascular staircase as thoroughly as possible. Next, incorporate ankle extensions, which you can easily perform while resting in bed during the morning and evening hours. Point your toes straight out away from your body, and then pull them firmly back toward your shins, mimicking the exact motion of pressing down and releasing an automotive accelerator pedal. Complete 20 of these extensions. This action effectively flushes out the lowest chambers of your vascular staircase before you have even set foot on the floor for the day. By the time you reach the third week, we focus on making physical movement a constant habit. The absolute greatest adversary threatening your lower leg pump is prolonged, motionless stillness. Therefore, the operational rule for this third week is incredibly straightforward. Never allow yourself to sit or stand in one exact spot for longer than 30 minutes without intentionally moving your feet. Utilize a quiet timer on your phone if you require a reminder. The moment it signals, you immediately stand up and complete 10 heel raises, perform 30 seconds of the seated deep muscle contractions, or simply take a brief walk to an adjacent room and back. A short, casual walk represents the most natural and effective calf pump exercise in existence, as every single step serves as a direct contraction of that circulatory engine. On top of this movement routine, you should implement 2 supportive practices that make the pump's job significantly easier. The first practice is deliberate elevation. Once per day, lie down flat and elevate your lower extremities so they rest entirely above the level of your heart for approximately 30 minutes, propping them up securely on pillows or resting your feet directly up against a wall. This positioning allows gravity to briefly work entirely in your favor, completely draining those vascular chambers. Second, if your healthcare provider has explicitly recommended the use of compression garments, ensure you wear them consistently. These garments apply gentle pressure to the vascular staircase from the outside, helping those internal barriers maintain their seal. The physical exercises and the compression garments are designed to function as partners, not competitors. That outlines the complete strategy. A seated movement that retrains the overlooked deep muscle, a standing exercise that powers the entire pump mechanism, an operational rule that prevents the pump from ever falling completely asleep again, and 2 supportive habits that alleviate the workload resting on your strained internal barriers. Now let me outline with absolute candor exactly what this program achieves and what it cannot do, because I want you to trust my guidance at the conclusion of these 3 weeks, rather than feeling let down. Let us look at what reverses quite rapidly. The sensations of heavy limbs, the fluid retention that builds up by evening, the persistent aching, and the nocturnal muscle cramps all respond remarkably fast, often within the initial 2 weeks of consistency. This rapid improvement occurs because those symptoms are directly caused by stagnant, pooling fluid, and an actively engaged muscle pump immediately sets that fluid into motion. As a result, morning swelling decreases. The indentations left by your socks fade much quicker, and your lower limbs simply feel noticeably lighter. This outcome is thoroughly backed by concrete scientific evidence. Comprehensive clinical reviews demonstrate that structured exercise regimens significantly enhance lower limb pump efficiency, overall muscle power, ankle joint mobility, and the general quality of life for individuals dealing with venous circulation issues.
Now, let us examine what improves at a more gradual pace over the course of several months rather than a few weeks. The foundational strength of that muscular pump itself and your body's long-term capability to maintain low internal pressure day after day. Controlled clinical trials have demonstrated that following 6 months of dedicated, structured lower leg muscular exercise, patients saw their circulatory pump metrics return entirely to normal baseline ranges. Notice that the data says 6 months, not 3 weeks. Therefore, view these 21 days as the crucial starting point where you begin to physically feel the difference, while the deeper structural repair continues to progress long after that initial period. Finally, here is what absolutely does not reverse, and I refuse to pretend otherwise. That exact same clinical research revealed that physical exercise does not structurally repair internal barriers that have already failed, meaning it does not eliminate the underlying backflow of fluid. The specific valve gates that have suffered structural breakdown will remain broken. A large, prominent, twisted varicose vein that is already physically present on your leg is not going to magically disappear simply because you performed heel raises. What fundamentally changes is that your newly strengthened muscular pump now easily handles the physical load that those broken internal gates can no longer manage. Because the pump takes over, the internal pressure drops significantly, the uncomfortable symptoms subside, and your downward slide along that health timeline slows down to a complete halt. You are not physically rebuilding those broken internal barriers. Instead, you are constructing an engine so incredibly powerful that the failing gates simply stop mattering nearly as much. For a blood vessel that has already grown substantially large and problematic, a vascular medical specialist possesses highly sophisticated, genuinely effective clinical treatments, and the muscular work you perform ensures those medical treatments hold up much better over the long term. So, that is the honest agreement between us. Rapid relief from discomfort and a noticeable return of function over the coming months, while existing structural damage remains a conversation best had with a medical specialist. Crucially, the overall direction of that entire 20-year timeline is something you possess the direct power to control, starting this very evening. Before I conclude, I want to pose a question to you, and I make it a point to read every single response. Please share your current age group in the discussion space below. Simply indicating the specific decade is perfectly fine, whether you are in your 50s, 60s, 70s, or 80s. I am asking because the specific vascular timeline I detailed moves at entirely different velocities depending on your current starting point, and past the age of 70, some of the skin alterations require a much more gentle, modified approach when it comes to the standing exercises. Therefore, when I put together the next guide, I want to know exactly who is engaging with this information on the other side of the screen. Go ahead and share your current decade below. Let me leave you with one distinct visual concept that I want you to carry with you moving forward. Your lower limbs house a beautiful staircase of stepped chambers, constantly fighting to move fluid upward against gravity all day long, every single day. Those bulging, prominent vessels you can spot on the surface are simply pressure gauges, letting you know that the internal barriers are growing exhausted. However, there is a powerful engine positioned right at the base of that staircase, a deep, incredibly patient, fatigue-resistant muscle called the soleus. For the vast majority of your life, no one ever pointed out its existence to you, and no one ever warned you that it had quietly gone to sleep. You do not need to spend your energy chasing the visible vein. You simply need to reawaken that deep engine. You can initiate this process the very next time you find yourself sitting down. Keep your toes firmly planted, elevate your heels, and maintain a slow, steady rhythm. That small, deliberate movement practiced consistently is your way of firmly stepping on the brakes to halt 2 decades of gradual decline. Give it 3 weeks to experience lighter legs, and dedicate the rest of your journey to keeping them that way. I look forward to seeing you in the next discussion.